Hey there, and welcome to the Think Fitness Life podcast. We're fueled by the incredible clients who inspire us every day, allowing us to elevate their health and fitness journeys. On this show, you'll gain valuable insights from top professionals, hear inspiring transformation stories, and discover the knowledge and motivation to create your own best life. Let's dive in. As someone who has continuously used therapy as a way to heal and elevate my personal performance, I know wholeheartedly that you cannot always read the label when you're in the jar. And that's why it's so helpful to have a professional in your corner to talk to. This podcast is sponsored by BetterHelp to provide our listeners with the opportunity to work with a licensed therapist from the comfort of your own home. Receive 10% off your first month when you sign up by going to betterhelp.com/TFL. That's betterhelp.com/T as in think, F as in fitness, L as in life. And remember, you're not alone. There are people out there who can help.
All right, welcome back to the Think Fitness Life podcast. In today's episode, we're going to dive into the world of longevity and quality of life, beyond the fountain of youth. And that is the name of the book by our guest today, Dr. Julian Gershon, who in this book is diving into the realm of regenerative medicine. Many things people have heard about, but maybe have skepticism towards: hormone replacement therapy, PRP, stem cell therapy, how to use these to enhance quality of life. And if you are injured, how to use these supplements and these tactics to improve overall health. And things that you can do in a daily life that can drive overall health. As we age, we start to lose these factors. We're going to dive into all of that on today's episode. So without further ado, Dr. Julian Gershon.
Where did it start? Where did my book get its start? Well, I've actually had the title in my head for about 5 years. And, after 22 years of doing this, I just wanted to find a way to put everything in one place to tell the story, really, because people in general are pretty clueless. Unfortunately, 90+% of conventional medicine doesn't share this information with you, or they tell you, yeah, you can't take hormones. You're going to have prostate cancer if you're a man, or if you're a woman. Yeah, hormones are bad. You'll have breast cancer. And that's just not the case. The opposite is true. We know at optimal hormone levels, we have an overall decrease in mortality, a decrease in all forms of cancer. And the data is there, and it's just unfortunate that, conventional medicine has its head in the sand, really, ignoring many of these breakthrough, studies. But, it started some time ago. My background is sports medicine. I was lucky enough to have been an Olympic physician multiple times. I was a head team physician at the University of North Texas for 20 years before I moved to Aspen back in 2010, 15 years ago. When I turned 50, which is now 22 years ago, that's when I started doing testosterone therapy. A couple of good buddies of mine, and I talk about it in my book, Bob Goldman and Ron Klass. Bob and I were on the board of our National Academy of Sports Medicine for DOs. And I just remember showing up at a board meeting back in '89. And it's like, well, where's Bob? And, he was doing some anti-aging thing. And I literally quoted, he's lost his mind. And it wasn't until 2000 that I made a decision to attend a conference with the American Academy of Anti-Aging Regenerative Medicine. And when I did, I was, shocked really that there were over 5,000, providers from all over the world at that time. And I've gone every year for the last 22 years, and it just continues to grow. And now with, the biohack movement and all the podcasts like yourself and people with genuine interest in longevity, in health, in alternatives to conventional medicine. And all we really have is a sick care system. We don't have a healthcare system in America. And although we're developing that, and it's been an uphill fight for 20 plus years, that's really my background and how I got started, studying. I'm now board certified in 3 specialties: family medicine, sports medicine, and anti-aging and regenerative medicine. And I've done a stem cell fellowship through the American Academy of Anti-Aging and Regenerative Medicine. I've done well north of 1,000 different kinds of stem cell and exosome injections. And I talk about that in my book, just the benefits and the uses of, the different technologies that we now have.
And that's one interesting thing you say with the conventional medicine. Why do you think they're delayed in getting up to speed with some of this stuff? Because you hear it out there, but a lot of the doctors I work with and talk to, they'll be like, well, there's not a lot of research and I'm not really sure yet. I don't know if they haven't really read into it or what, because after reading the book, there seems a pretty good case for some of this stuff, like PRP and some of this replacement therapy that has a place for human health.
Yeah, absolutely. Well, I don't know that I can answer that question. Well, they're just not aware. Conventional medical societies are not teaching this. There are some medical schools starting regenerative medicine programs, and I applaud them for that. There are a number. The American Academy of Anti-Aging and Regenerative Medicine, Age Management Medical Group, which was founded by guys from Cenogenics, which was a Las Vegas-based clinic. I trained through them as well, from some pioneers in, testosterone therapy, regenerative medicine. And as it just continues growing, my main mentor in the hormone world would be through World Link Medical in Salt Lake City, Neil Rouzier. Neil is a former, emergency room physician who is an evidence-based guy. And he has taught thousands, probably tens of thousands of physicians, nurse practitioners, physician assistants through a multi-part, 5-part series. I go annually to a review that he does, and reviewing all the latest literature and why some studies are poor studies. Why here's a Class D study that says testosterone's bad. Well, I won't get into all the different types of studies, but you can design a study to show almost anything. And if they're not double-blinded with specific treatment doses, specific outcomes, measurements, and they're just literally a generalization of here's what we saw with 20,000 people of a certain age group, well, those don't really tell you much at all unless you know the very specific parameters that people were treated under and not just, quote, observation. It is interesting. I mean, it's a giant can of worms, really, as far as trying to get to the bottom of correct information to find out what's safe, what will help me to live better longer. That's my motto.
And in the book, you dive in, kind of the main thing is, a big first thing is men's hormone replacement therapy.
Mm-hmm.
And a lot of people have questions to me, and I really can't, I don't have the background or degree to answer and just like, hey, this is safe or not. But I've read some stuff about it. I've talked to people on it. Let's start to go into why go on hormone replacement therapy, the benefits of it, and why would someone look into this, maybe after listening to this podcast or reading the book, with more interest?
Well, it's, and I always tell people, when you think about it, the barometer and everything we try to do in optimizing hormone levels is stepping back in time, whether you're now in your 30s, 40s, 50s, and beyond, to, well, how are you in your 20s, from 20 to 25? Do you really know many sick 20-year-olds? The answer is no. Other than perhaps type 1 diabetes, there are not a lot of adult onset diabetics in their 20s. You didn't have high cholesterol or high blood pressure, high inflammation markers at that level. Why? because your hormone levels were at their best, at their peak. And that is really the barometer, and the goal is that we reset your hormone levels, irregardless of age, to where they should be, or where they were, in your early 20s. Because as we have peak levels, let's say of testosterone for men and human growth hormone levels, inflammation was almost non-existent. And it's inversely related to your hormone levels. As hormone levels decline, inflammation markers increase. And what happens with that? Well, that's the start of the silent inflammation, the silent killer, is when we start seeing blood pressure elevation, changes in lipid metabolism, cholesterol metabolism, and glucose metabolism, muscle metabolism. We start losing muscle mass, having more body fat, cognitive function changes. And really the goal is to reset everything to those levels so that we know are safe. We're not doing, I have people say, well, do I have to cycle this? Or do we, I heard this guy, they do this for long and then they stop and then you do that. Like, why did you do that when you were 20? Well, the answer is no. It was good all day, every day. And we know that's what produces really the best results.
Because a lot of people that are older, they are going on, or even people who will find their levels have been plummeted. And a lot of ex-military guys will go on it. What is the big draw? Because now in the book you talked about these hormone healths. And then for the first time I've heard about this, usually people think HRT or TRT. You have to go needle injection. We're looking at a whole different world of medicine starting with these pellets. Let's dive into how that works and how this is going to be easier for people to get the benefits without worrying about needles and injections.
Well, everyone's different, and it's patient preference. I still have plenty of patients that do self-injection. I teach them how to use testosterone, usually every Monday. HCG, or human chorionic gonadotropin, will use often, let's say on Fridays if they're taking an injection. I have some guys splitting the dose and doing a couple of testosterone injections. It's never once or twice a month because there's a huge peak, huge trough. Injection therapy can be learned how to do it safely at home. You mentioned pellet therapy. I love pellets. I did a couple of patients already this morning. And, it's where we take a compressed tablet of testosterone in a specific matrix that helps to bind it or hold it together. And we place them either in the love handles or up over the hip pocket. I like the new technique developed by a company called Invexius that work very well. And they are minimal discomfort really to put them in, a little numbing of the skin, and then you don't feel it really at all. And they dissolve, let's say, based on the blood flow to that area, based on cardiac output, over the average of 5 to 6 months. And if we get the dose, they usually last 6 months in men. Every 3.5 to 4 months for women. And I do pellet therapy for men and women. And it's a very effective, way to do it. I love it. It works great. We get some of the best blood levels. Now, I have a lot of clients, patients all over the world, where we do telemedicine follow-ups. Obviously, if they're not going to be at my office in Aspen or Denver, I can't put their pellets in. And for those patients, using other methods of hormone administration may be better for them. And it can all be done very safely and very effectively. And again, it's critical to do blood work at the correct times. For men, usually around anywhere from 6 to 8 weeks after a pellet insertion. On guys that I have on injection therapy, I do blood work every quarter, every 3 months, because I don't want to leave anything to guesswork. We don't want it to be too high. It's actually very safe if it is a little on the high side. But the converse of that, if they're not getting all the benefits because the levels are too low, I want people to feel their best. And it's very important that it's done in a very kind of a structured way, and it's easy to get blood work done almost in any lab in the country.
And for the blood work, when people want to go on replacement therapy, are they at certain levels of testosterone or estrogen that you look for, or is it just looking at the blood work and bringing them to where they might feel the best?
Well, it's a combination of all that. One, I give them a checklist with about 20 items on it, with from never, mild, moderate, severe, energy level, libido, cognitive function, brain fog, vitality, muscle mass, abdominal fat. Where are you? How do you feel? And it varies. We start losing testosterone as young as 30, 1 to 3% a year. And I see now many dozens of patients in their 30s, where 20 years ago, the average age was in the 50s. And that's a whole nother topic. I'm kind of wandering off here now. But, when we talk about estrogenic compounds and environmental factors of things that I believe are of actually epidemic proportions. I never used to see 30-year-old guys. I have dozens of men in their 30s. And I would preface that with saying, I don't always give them testosterone. I do different precursors to stimulate testosterone production. I think it would be a great disservice, if not criminal, just to put everybody on testosterone. There are younger men that I deal with that I use clomiphene or N-clomiphene along with human chorionic gonadotropin HCG injections, and it works, let's say 70 to 80% of the time, we get good levels. Your question was, how do you know? Well, from that questionnaire, how are you feeling? How are things different now than when I was 20? And it's hard to remember, but we took everything for granted. You were bulletproof. You felt great. You maybe didn't always do the best things for yourself because of that fact. You had a great recovery time. You stayed up a little late. You just got up and worked and kept moving, and that's not easy as the decades start to roll by. But, if the range at a hospital lab, let's say, is 280 or 300 to 1100, well, I have guys come in all the time. They're 400, 500, some even 6. And if the benchmark was at 1,000, well, where are you? You're in the 40 or 50th percentile. And actually, it's not the total testosterone, it's the free testosterone. How much of that is not bound to protein? What's really bioavailable? And it's a pretty small number. It's 1 to 2%. If your testosterone was 1,000, your free testosterone was around 20. That's where I want you to be. I want it to be in the low to upper 20s all the time. When I see someone that comes in, let's say it's 400 or 500, and I can tell you when I started doing this 22 years ago, my testosterone was 500. My buddy, who was my primary care, said, well, you're fine for age. You're in the normal range. Well, that's not what I was studying and learning. My free testosterone was 10. Well, what's good about that? Nothing. Nothing works the same. And as we improve total testosterone and get free testosterone back up in the 20s, and that number for women is much different. It's 2 to 4, not 20 plus. And, we have different levels that we're looking for. And I won't get into all of that now because estradiol, progesterone, testosterone, it's a little more complicated in a different scenario for women. And I see lots of girls in their 30s, 40s, years before menopause that are suffering from low progesterone, low testosterone. And it's not just a menopause thing. But I just wanted to point out where those numbers need to be for patients to really feel their very best.
Oh, yeah, because a lot of people, they get that range, they don't know what to do with that range. And most times, they send some doctors to be like, oh, well, you're in the middle. And that's okay, but I like how you go off on quick stamps. It's really about how people feel. what their daily life and quality of life is like, because that's what really matters to us. And when you go into the factors that testosterone now referring to plummet, when some of these people, men and women, are hitting 30s because of environmental factors, it's, I don't think people take it into factor or take it serious until they get to the point where all of a sudden, like, what's going on having all these adverse effects. But let's go into, these factors that are causing poor health and bullet hormones from men and women's diet.
Well, again, as you said, as those levels start to decline, then we see changes. All of a sudden, our blood sugar is a little high. Most doctors will check a 60-day glucose average, what's called a hemoglobin A1C. Then that used to be 6 and above was pre-diabetic or diabetic. And every decade it's come down, where now anything above 5.6 is too high. And we know many things happen when your blood sugar is too high, and from changes in energy levels and fatigue, but a metabolic process called glycation, which is, quote, sugar coating of your proteins. And we can do a test, a glycan age test, that tells us biologic versus chronologic age based on the amount of glycoproteins in your system, and really how they are negatively affecting everything from inflammation markers. When you think about it, we didn't have high cholesterol, you didn't have plaque when you're a younger person. Well, why do we get it? And I tell people all the time, it's not from cholesterol. It's from inflammation, low hormone levels, and too much sugar. As we have more glycoproteins, more sugar coating of those proteins, then they now get sticky and grab onto those fat molecules floating by, and they see the inflamed coronary arteries, and they lay down plaque. And why not just avoid all that in the first place?
As the baseline.
Yeah.
And people are getting into treacherous waters by a lot of what they're eating. And when they're younger, they can recover from that. And they might not feel the effects, but then 30s, mid-30s, like, even my friend, like, I started to see it, you're like, oh, damn, what happened to them? Or people that I was in college, high school with, all you're like, whoa. You can tell that they haven't taken care of themselves. It's a complete change where some people look like they're 40-something, but they're around my age.
Yeah. Well, our diet is terrible. It's full of carbohydrates and processed and refined sugars. I believe in the carnivore diet, in keto diets. And really, it's not cholesterol that kills anybody. It's the inflammation, too much sugar, high carb diets, processed foods, glyphosate, chemicals and everything. And, it would take us another hour to talk about all of that. But, you have to start someplace. And you need to know where your numbers are, and you need to search out someone like myself that understands it, that, is perhaps a member of the American Academy of Anti-Aging and Regenerative Medicine. You can go to their site, you can go to WorldLink. You could look for certified providers that are taking the time to learn. There's a lot of education happening, and it's, a lot of people are interested for a number of different reasons. And if you don't get the answer the first time you look, keep looking, or send me an email and we'll try to help. There's too much information out there for you not to. I tell people you need to become a student of this.
And it's hard because a lot of people, like, my dad and I were talking about asking the nutrition question, and we got higher cholesterol. They put him on a statin, but he wants to come off it. His blood pressure, he's been working out, coming down. And he challenged the doctor a little bit. Like, oh, can I come off this, And I always tell him about, I say, it's not about the cholesterol. His triglycerides are great. But traditional medicine just would go, hey, you have higher cholesterol. We need to put you on a statin. We need to keep you here. Where he's like, well, now I'm trying to challenge the thought process to feel better.
Well, as we as physicians have been brainwashed by big pharma for the last 40 years from thyroid function, and they're pushing synthetic thyroid down our throats to, there hasn't been a change. There's now a multi-billion-dollar statin industry. The death rate from heart disease has not changed 1% in almost 40 years since the Framingham study. Why is that? Well, I'll tell you to Google David Diamond, MD. I've met him a couple times. I heard him talk. He reviewed all the literature that Big Pharma based their first studies on, where they illegally extrapolated a 3% difference in the death rate to 33%, and that launched the statin industry. It was based on bad data. And now, almost 40 years later, everyone thinking, I know cardiologists, I play golf with them, that think statins should be in the drinking water. I'm like, give me a break. The death rate hasn't changed. How do you explain that? Well, they don't. They can't. Yeah. And, it's to me, the key is the foundation of hormone balance, reducing inflammation, getting sugar out of the diet, not to mention all the chemicals and glyphosate and other compounds that we're exposed to that is destroying masculinity in America, if you have.
And that's a big thing. And we are having science to combat that. But still, if people, like yourself, you're in the book, you've gone on therapy, I'm sure you're still eating solid nutritional strategies, carnivore, clean eating, not a lot of sugar. I think people still need to realize you can't just take hormone therapy and expect to just do whatever you want. But you do bring into the picture, especially in the book, is women's, because a lot of women don't know about it. Let's dive into that. You said earlier you mentioned low libido, low levels of energy. They're almost healing menopause earlier. What's their trajectory going on hormone therapy?
Well, it's almost identical. I mean, it's a day and night difference on how people feel. And it is more complicated. I see a lot of younger women in their 30s, 40s, sometimes after childbirth, sometimes not, where the system's just off and it hasn't reset for some reason. A lot of PMS symptoms, bad cramps, and those are low progesterone. And that's really pretty easy to fix. You use small amounts of progesterone throughout the month, and women feel significantly better. Low testosterone. These things happen decades before menopause, before estrogen. When estradiol drops, when I say they fall off the cliff, literally, that's when all hormone levels plummet, and women are used to it. Yeah, somewhere in my 50s, or sometimes earlier, sometimes later. But, there's a lot that happens to younger women before that. And the goal is to restore those levels to where they were, in your 20s and keep them there, and it doesn't take a lot other than paying attention. What happened 30 plus years ago, back in 2000, really, when the World Health Initiative study came out, and that was on synthetic hormones, Premarin, Prempro. Those estrogen and progestins, not progesterone, are made from horse's urine. They're synthetic. They're not natural to your body. And they cause some significant problems, from blood clots to stroke, heart attack, and all doctors across the world were terrified and stopped prescribing hormones. Well, it was a pretty flawed study, and it did not measure natural bioidentical hormones. There's been a lot that has happened since then to prove the safety of natural bioidentical hormones. And unfortunately, many just didn't. I deal with it all the time. I just saw a woman here this morning. They're down visiting their family in Aspen from Wisconsin. And she was on my program and stopped about 2 years ago. I just saw her husband to do some regenerative therapies today. And and do his testosterone pellets. And she had me redo her blood, and she's like, well, we need to talk next week because I don't feel like I did while we were doing this. And I'm like, but her brother is a retired physician, and he gave her all kinds of grief on how she was going to have breast cancer. And, here I'm handing her articles and read this one and that one and give him a copy of my book, please, and it's just unfortunate, when that happened back in around 2000 and that study came out, everybody panicked, and for good reason. And now I never write a prescription for synthetic Premarin or Prempro. I won't even work with a woman who insists on continuing it. And most don't. They're like, you mean that's bad for me? Like, well, yeah, and here's why. Here's the study. And you need natural bioidentical hormones, and we don't see that. We see actually a reduction in cardiac events. The number one killer of women over 50 is a heart attack. Why is that? Because without estradiol, the arteries get stiff and rigid. And I talked to her about that today. I said, an estradiol has been shown to not cause breast cancer, but actually be breast protective. And there's just, there's new information out there. And unfortunately, the die that was cast, and it's taken a long time to swing the momentum of thought and to get where people are willing to learn new things. And I have a buddy who's my concierge physician that refers some people to me for peptide therapies. Like, I don't want to learn something new. I'll send them to you. Well, is okay, but it's not that hard. Here's where you go to find that information.
That's where a lot of people are searching the thing up that I've heard my clients say. Because I mentioned, have you thought about hormone replacement? Well, it could increase risk of cancer. And I think maybe from the guy's side too. But it's interesting, I didn't know about that study, that it was more synthetic.
Mm-hmm.
Now, we're in a whole different world of hormone replacement therapy than it was back then. It's much more safer, would you say?
Well, absolutely. And it's just, then there was the awareness factor. That just threw a blanket on everything, and everybody stopped. And they didn't differentiate between natural bioidentical hormone replacement and synthetic hormones, but that is wherein the difference lies. And it is very safe when done correctly.
And that's something I think a lot of people think, like, they're going to go on testosterone, they're getting like bodybuilder, like steroid drugs. Like,
No.
Some of these are just, depending on the dose, it's minimal dose compared to what, you see in the workout industry, workout world, for astronomical.
Yeah. And with many side effects. I mean, that's the last thing. I had a few clients, I won't go into it, but I won't continue to see them if they're, taking superhuman doses because they've got a competition coming up or whatever. I'm like, who cares? I want you to be here 20 years from now. It doesn't matter what you look like, because you're not going to stick around. You're doing irreparable damage to your heart and internal organs by megadosing hormones.
Yeah. I mean, people look for that quick fix. And there's no megadose things. But I had one client, she's an older female, she went on more about, I think, the testosterone cream.
Mm-hmm.
And she said that she was like, I feel great, I feel strong, I feel youthful, regenerative. And that was the first time that I had a client that was female, went on testosterone cream and was like, this is great.
Yeah.
It changed how she works out, how she lives life, how she moves and functions.
Yeah, absolutely. And it's that way for almost every woman that gets her testosterone level restored, progesterone, eventually estradiol. And I have some in that range, prior to they're either in perimenopause when things are all over the place. That's a difficult time, because 1 month it's up, then it's down, then it's up, then it's down. We just want to raise the baseline so that they don't have those big swings, and testosterone, and progesterone play a big role in that. And very rarely small amounts, very small amounts of estradiol. But in general, again, it all depends on what the blood levels show. It's very important that it's done and then it is reviewed by someone qualified to do it. I see people all the time. They call and say, well, I don't need to do blood work. I'll just bring in what my other doctor did, and he said everything was fine. I'm like, well, first of all, they didn't even check any free hormone levels, no free testosterone, no free T3, which is an important thyroid hormone. And it's just a wild guess. And I don't want to sit and see you for an hour and take a wild guess. I want to see some black and white numbers and give you my best shot of what potential things could be done to help.
And that's why, Julie, the way the book was written was also really good, because you don't see a lot of books with these topics in it. Hormone replacement therapy, men, women, PRP, some other stuff. People are just looking for that stuff. They don't know how to digest it. But when you read the book, link is in out. Section, paragraph, here's how to feel, here's what's going on, here's the science behind it. But really well written for people to digest that, or like you and I are looking for maybe deep science, but are just looking for overall health.
Well, I really appreciate that, because it was a pretty scary undertaking, not having written before but wanting to tell the stories. I did it really in a conversational format. This was all done in a kind of interview format. I reviewed, each topic and wanted to just talk about the things that I do and know and what difference, how we implement that for the average person to help them just, one, be more aware, and then hopefully at least have some discussion points with other people, other physicians. Everybody's going to come to see me and ask me, and I do, I talk about all this in my podcast as well, on our website, to social media. It's just, my mission is to get the word out and try to help as many people as possible.
And at the end, when I first kind of scrolled through a book, what really got my attention was PRP. Mm-hmm. Because where I work with orthopedics. The doctors, most of them are very, I'm not going to say anti-PRP, but they're just not for it because they don't feel like it works enough. And it's not this magic all of a sudden thing that cures it. They go more on the cortisone side because it's more of an effect. But let's go into PRP, because you kind of really hit it on the part from hair, face, skin regeneration to healing injuries. PRP, very underlooked from what I feel like is the medical industry, but how do you use it to heal and regenerate and heal?
Yeah, well, it's really interesting because I've been doing PRP for 20 years. It's been around a long time. It's just slowly come to the forefront. I could tell you I've done an awful lot of cortisone injections in my sports medicine career. I almost never do now, because we know over time cumulative effects of cortisone is very bad for the cartilage in any of your joints. It will cause them to degrade faster. So that's not what we really want to do as physicians. We want to help people feel better, help them reduce their pain, etc. And so it is the quick fix. It does work well. There are times when it's necessary, but platelet-rich plasma, we have a lot of growth factors in your own blood that stimulate healing. And when we can isolate that and then inject it directly into an area like tennis elbow, plantar fasciitis, rotator cuff tendonitis, tears, knees, hips, etc., they stimulate healing, and it doesn't have any negative effects. It may take more than one, depending on the levels of pain, what someone's dealing with. It's not a miracle, but why not use the healing factors in your own blood to help reduce pain and inflammation? And what if it takes another injection? It's not terribly expensive. It's around $1,000 for injection that can help you in many ways. And we use it for facial rejuvenation, stimulate collagen growth, reduce fine lines and wrinkles. We use it for hair growth, scalp. What works the best for hair is really exosomes, which are approved for aesthetic uses, and they come from perinatal tissue taken at the time of birth, containing hundreds of growth factors. Let's just say you have about a dozen good growth factors in your own blood. It was a little more than that, but let's just say a dozen. There's over 300 proteins, growth factors, messenger RNA when we're using exosome or perinatal product, or even harvesting your own stem cells, which I do from adipose tissue.
And what would you say to people that are leaning against PRP or say, how about we didn't about it? What's kind of, when you hear that, what do you think in your brain?
Well, it immediately for me is, number one, it's not possible that it doesn't work. It may not reduce your pain to the level that you want. It may take more than one injection. It is not possible for those growth factors to try and decrease inflammation, to stimulate the healing process. It just may not be one and done. You may have to do another, depending on the severity of what's going on. Or, was the injection accurate? Was it done with ultrasound guidance? Did they get the needle exactly where it needed to be to stimulate that healing process? Because it's, even in the best of hands, it can, we can miss the mark sometimes. Until I started doing ultrasound guided injections, I don't know, some 15 plus years ago, I thought I was pretty darn good at shoulder injections, at certain things. And the reality was I was off by millimeters to centimeters, and that can make a big difference on whether you hit the joint capsule or not. And if you don't look, how do you know? That's a whole other story. But, most of the time, platelet-rich plasma is very effective in run-of-the-mill musculoskeletal injuries.
I think people look to it that it's the same as like cortisone, as like, oh, it's going to alleviate pain. But you also mentioned in the book that you will have a good environment for it to work. You can't do PRP and eat like crap and not do all the things. And I think that's where a lot of these methods that help rejuvenate, recover from injury, or help skin hair, people think it's, like you said, this magic bullet thing that just works, but it doesn't. You have to have everything work together for it to be optimized.
Yeah, exactly.
And it's crazy because I look at some of the athletes that I work with that have had PRP, and some people freak out. They're like, oh my gosh, I had PRP. I'm like, that's awesome. What are they doing? Let's have that next conversation, because you can combine PRP with other things to help recover, help rejuvenate muscle tissue, tendon, help heal the system. What are some of your things that you like to pair with PRP or digestive stem cells, some of these things to really boost that longevity and quality?
Well, yeah, I mean, there's a lot of things. Peptides are now the rage. There's a lot of peptides, and I've just been asked to be an advisor for a new company that's helping to take peptides and telemedicine to the average person, and which I'm happy to talk about another time. But, I use peptides have crazy names. There are certain peptides, they all have a specific activity. There's one called BPC 157 that I prescribe and share patients all the time. It is a great anti-inflammatory. It can be taken orally, sub-Q. I have people that use it just for post-workout. They feel better and recover faster, but it can be used in conjunction with other things like PRP. There are peptides that increase growth hormone levels. Well, why do you want to do that? Well, to reduce inflammation. The better your growth hormone levels, and again, they should be checked. You shouldn't just guess, but that helps suppress inflammation. And doing stem cell harvest and exosome therapy for musculoskeletal is, there's nothing better. I mean, it is really stimulates tissue growth and healing in a way that, PRP can only hope to do. And I use them together. Almost every time I do a joint injection, whether it's stem cells, exosomes, I'll do what I call the fertilizer shot. And about 6 weeks later, I'll use PRP, use your own, to help maintain a good environment that we can get cartilage growth and get, reduction of inflammation, whether we're treating a rotator cuff tear, tear of the labrum, let's say the lining of the capsule and the shoulder or the hip. And there's just a lot of different ways that we employ those therapies.
And when people hear you say stem cell, they're going to kind of probably take that back and go, wait a second. But in the book, you really break down that stem cell is legal, but it's not the embryonic stem cell.
No, correct.
Taking it from animals. Go into that a little bit of how you use stem cells and where it comes from to educate people.
Well, we harvest stem cells from your body, and adipose-derived stem cells. We can do bone marrow-derived stem cells, adipose-derived stem cells. Most people are like, okay, sign me up for that. I got a little extra, I'll donate. And really, it only takes, a couple ounces of fat to isolate a significant amount of stem cells that can be banked for future use. I banked mine in 2012, and I've used them every year since, just for, quote, regenerative purposes, sometimes for joint injections, sometimes other applications. It is very personalized medicine, and, it just requires making a plan, discussing how it works, how we do it, and going from there with it.
And how much stem cell do you get out from, like, what you say, like, just a little bit of fat? Do you get a ton?
Well, very good numbers, and it varies. We have averages at once they have been banked, then we can culture expand and grow very large specific numbers. We order them based on like 10 million stem cells per ml. We order a couple vials for a knee, put in 20 million of your own banked stem cells. When I do other treatments with it myself, annually I'll use 50 million cells. And it's just a matter of asking the lab to culture expand and create that, and then they're mine. They're available for the rest of my life. And the interesting thing with adipose, they're about half of your biologic age. Bone marrow-derived stem cells turn over a little faster. They're not, let's just say, as young.
But it's fascinating that you can take that science to increase quality of life, longevity, and health with using organ on its because you can inject them. And have I seen this? You can also drink them.
Though I'm not aware of that. Yeah,
I thought I saw something a couple of years ago that people were ingesting their stem cells that they can harvest, but I wasn't sure. If you know about that, or more just like, hey, we're going to inject them into science for healing, growth, whatever. It's the world of science that we're diving into, and this is all in your book. And when does the book come out? Because I don't think it's out yet.
Well, it is. It launched last November. It's a bestseller on Amazon. And you just go to Amazon and type in Beyond the Fountain of Youth. You should see it. And yeah.
Awesome. And I know we're coming up on the hour here, but where can people find you? You said you have your own podcast.
And again, my podcast is on Apple, on YouTube. Just put in Beyond the Fountain of Youth podcast. If you don't add the word podcast, then you see all kinds of stuff on the Fountain of Youth, including a movie that's out now. It was great. I loved it. You just kind of a search for the Fountain of Youth. It was very interesting. And our website is aspen-regenerativemedicine.com. We're on Facebook, Aspen Institute for Anti-Aging Regenerative Medicine. Dr. Julian Gershon is where we post everything on Instagram. We're kind of everywhere. We share podcast snippets there as well. Shouldn't be too hard to find. My audiobook just came out on Spotify a few weeks ago. and I'm still trying to figure out how to find it.
Is it this one in the audiobook?
Yes.
Now, did you recording yourself lately?
I did. Yeah.
That's cool. If you don't want to read it, you can just listen to it, and it's probably going to read very similar to a podcast.
Yeah.
Information after information, section after section. Well, we appreciate you coming on.
Matt Gluckman and Eric Menchie here from Think Fitness Life. Our entire careers have been dedicated to fitness, particularly how the mind helps the body. We've been around gyms and nutrition strategies for 25 plus years collectively, and nothing harms or helps better than your own mind, untrained or trained. Pushing beyond your limits, overcoming whatever's thrown your way, and making the decision to show up day in and day out as a lifestyle takes more soul than sand. And what I mean by that is when you can get your mindset and heart leading you consistently in the direction of your goals and dreams, well, it's just a matter of time before you have the performance, physique, or quality of life you're yearning for. See, your thoughts will stem from your beliefs, which will then lead you to action, which develop into your behavior and ultimately lead you to results. It's really that simple. Our process takes time and it takes open communication. It's amazing what pops up along the fitness journey to betterment, and we can be there every step of the way. To learn more or apply for coaching, visit www.thinkfitnesslife.com. Start recreating your life today.